So what is opioid addiction? Addiction, also known as substance use disorder, is a chronic disease, just like other chronic diseases such as diabetes, high blood pressure, and asthma. And just like other conditions, it is treatable. Opioid use disorder, or opioid addiction, is use of an opioid, either a prescription or an illicit opioid like heroin, that is compulsive, meaning you cannot control it, dangerous, or both. Opioid use disorder is an illness. It is not a weakness or moral failing, though some people still mistakenly think it is. Substance use disorders, including opioid use disorders, can affect anyone, regardless of age, gender, race, ethnicity, whether you're rich or poor, employed or unemployed. Like other conditions, there are some key symptoms that define the illness. One is tolerance. Tolerance means you need an increasingly larger amount of the substance to get high or relieve withdrawal. Another symptom is physical dependence. I want to talk a little bit more about how dependence develops and how someone feels once they have dependence on a substance. On this graph, you can see a person's mood on this side and then their use and how they're feeling over time as we move over to the right. So in the beginning, when they're using a substance, they may feel euphoric or good, and then after use, kind of dip down here where they're not feeling so good with their mood. But over time, as their brain changes and they become dependent on the substance, they get to the point where they're over here in the red and they're feeling bad all the time without using the substance. Their brain is dependent on it, so they need to use the substance just to feel normal. If they don't use the substance, they have withdrawal symptoms. What does withdrawal feel like? It feels pretty terrible. You can see the list of symptoms there. Nausea, vomiting, diarrhea, irritability, craving, tremor, pain, runny nose. Or in the words of people who have experienced it, they feel sick, vulnerable, scared, and like I'm going to die. Pretty unpleasant. So besides tolerance and dependence, another key symptom is craving. Craving is a primary symptom of substance use disorder. It's an overpowering need to use drugs. This need is as powerful as our need to breathe, sleep, eat, or drink water. The brain actually thinks it needs this substance to survive. Loss of control is another symptom. This means someone is using more than they meant to, or they're trying to quit but cannot. It almost feels like they're using against their own will. It's a feeling of powerlessness that they don't have control over. In treatment, skills and techniques can be learned to help with this. Another symptom is continuing to use despite negative consequences. So bad things happen and the person still uses. It's common for the person to see the opioid as the solution rather than the cause of the problem. It may be that if they have a very significant negative consequence, they may decide that they don't want to use anymore. But in the absence of appropriate treatment, which may include medications and learning behavioral skills and techniques, they may fail. Essentially, when someone has a substance use disorder, their brain is hijacked. It's no longer working the way that it used to, and this can impair social relationships, and it can cause failure to carry out important roles at home, work, or school. The most important thing to know is that just like other chronic conditions like diabetes or asthma, opioid use disorder is treatable through medication and behavioral interventions.